Hello my friends, how are you? Today we are going to talk about tendinitis in the knee articulation. In this case, what we are going to look is, this is the disease, this is the tendinitis of the patella, patelo-tibio-patellar tendon. And in this case, what is going to provoke the disease? Maybe it's problems in the foot. If you don't have a good you don't make a good step on the foot, or there is disease of the ankle joint or the little bone of the foot, maybe then it can make that the tibia is not in a good position. It provokes rotation of the tibia, and it provokes that there is disease in this tendon. So first thing is to look for disease, osteopathic disease, mobility disease in the foot. After this, sometimes what you have is shortened of this muscle. The quads are shortened. Most important muscle is this long muscle, rectus femoris, I think is the name in English. So if these muscles are tight, what we are going to provoke is lot of tension in the patella. The patella is going up, and it makes that the tendon is in a stretch, and maybe it provokes the disease. Leopold Busquet, one very famous author about mechanical chains, tells that sometimes it's the posterior chain, muscular chain, that is very, very tight. The hamstrings are very, very tight, and it provokes a posterior rotation of the iliac, and it makes that after this there is stretch in the quads, and it provokes that the patella goes superior. I put a stretch in all these mechanisms. So look for shortened muscles in the posterior chain or in the quads. And lastly is the sobreentrenamiento in Spanish. Sobreentrenamiento. In English is overtraining. If you are not accustomed, if you don't used to train in heavy weights, don't make extra training, because sometimes it can provoke that the patella and the tendon suffer more than usual and provokes inflammation, and after that what we have is like a lot of adherences in the tendon. And now we are going to treat this knee. What I like to do in the tendon that are with adherency, that are very, very, very hard, shortened tendons, what I do is to work with my hands, 3 years massage, deep and transversal massage in the point is very, very, very effective. The thing is that most of the times the part of the tendon that is suffering more is the part of the tendon that is below. This is the patella, this is the tendon, and it's very difficult to massage this part of the tendon that is far away from the skin. So what we do is to press the patella down to put it up, and then we are able to work with our finger down. It will be like this. We press the patella down, and then I make massage under the patella below, pressing up and hooking these structures. Is in a normal way, everybody is a little bit, it's like feel a little bit of pain. What I do is to make deep massage, not only with my hands, with other things. For example, one thing that I use a lot and it's true, is the key of a car. What I do is this part of the key that is flat and is not sharp, I put it below the patella, and it's a very good way to work in this area. And it's very, very effective. It's painful, put this it's quite painful, but it's very, very, very helpful, and it's very, very effective. And after that, nothing more. You can review the quads. Remember to review the quadriceps tendon, that most of the time is shortened as well. It means that all the anterior chain is in damage. Remember to review for all kind of disease in the quads, and also in the iliac, sacroiliac joint. In a normal case, most of the time it's in posterior rotation, and in the hamstring. And nothing more. Hope you like it. See you next Osteo-advice.